KRON4's Plastic Surgery Today with Dr. Stanley Jacobs.
Yes, good morning. I'm here with Dr. Stanley Jacobs, who brought with him a prop of saran wrap. I don't even want to ask what this is for. Good morning.
Morning. How are you?
Well, the topic is facelifts, and
Right.
Certainly not all facelifts are alike.
Right, and here's an example. If you give Leonardo da Vinci paint brushes and give myself the same, we're not going to come up with the same outcome.
Well, absolutely not. I mean, you are an artist.
So exactly. So what we want patients to understand is that what is a facelift? It's called the same thing, but it could be very different. So it's what they're getting, what they're paying for is the outcome, is the artist's
And yet,
end
as an
result.
artist, you don't want to leave your signature. People should never know your work.
You don't have to see a name, but you should have a naturalness. So there's a number of key things, and one of the things is the technique. And people talk about anatomy all the time, and I brought a little prop in today.
And that's what the saran wrap is for.
The saran wrap is for, and it's sort of like, you know, if this is the skin of your face.
Okay, don't suffocate, please. This is live TV.
It's okay. I can do my own CPR. So if you lift this tissue, if you lift the skin up only, which is say the saran wrap,
right,
then you're not going to get a proper facelift. And a lot of techniques are just doing some skin lifting under local anesthesia, and you're not going to get the right result that you want.
And we're not naming names, but these are very popular. They're infomercials. You've seen them. But the face is more than just skin. It's muscle beneath it.
And there's a fascial layer. There's different layers. So what we want the audience to get from this is that there's the technique that's driven, the surgeon's training and what kind of experience he or she has, and then the number of cases. Ask how many cases they've had.
Very important to ask a lot of questions. You brought a photograph with you of before and after, so let's go ahead and roll that.
Here's an example of somebody who is several months after post-op. She's had her eyelids done and facelift done. The skin texture's improved, but she looks very natural. But this isn't, and this result's going to last for many years.
Okay, can I ask? I mean, that's all she's had done. Is it a full facelift?
It's the lower, yes, the eyelids, the lower face, the cheek, jowl, and neck, and the chemical peel, which is what's made her skin healthier. Because a lot of sun damage.
Well, she's rolled back about, I'd say, a good 10, 15 years on that.
So those are the key things that we need patients, the audience to understand is that ask about these techniques, get sedation.
Yeah.
For the first, to save a few $1,000 or $2,000 is not worth it.
No, this is, you only come with one face.
And if you have a problem, to correct it, it's going to be a lot more.
All right, good information. Thank you, Dr. Stanley Jacobs. And I guess the rule of thumb, if you've seen somebody has a facelift, that's generally not a good job. Subtlety is what we're looking for.
Right.
All right, for more information, go to drstanleyjacobs.com, or you can call him 415-433-0303. Thank you very much for coming.
This segment is sponsored by Dr. Stanley Jacobs.